Thank you, Madam Chairman. I wanted to talk today, obviously, about the crisis in this nation with regards to mental health. Mr. Tabak, when you look at what is happening, it's clear that NIH has also identified this crisis as being one that is plaguing communities across this great nation. The White House in 2023, the mental health research priorities, those even showed they speak to digital platforms in terms of their effectiveness to treat mental and behavioral health outcomes. However, there are plenty of NIH studies that show how social media and screen time likely have a negative effect on mental health, particularly youth mental health. Now, let me tell you something. As a mama of a 13 and a 14-year-old, this is something that is particularly important to me. I look at how young people are having to grow up right now. I know as someone who went through middle school and high school as a young woman that it's tough. I can't even imagine the additional pressures that they feel given having a screen at their fingertips all of the time. I think the reports are shocking, and I don't think the numbers lie. Last year, 1 in 3 high school girls said that they seriously considered suicide. And actually, 1 in 9, or almost 9%, 1 in 10 high school students reported actually attempting suicide in the last 12 months. Folks, I ran for the Senate as a mama on a mission. I said that my children and other people's children and grandchildren should be able to achieve the American dream. If we do not take a hold of what is happening right now with social media and our youth, it is going to be so far gone we cannot get it back. And my question to you is, what is the NIH doing to address the damage of social media and what it's having on our children and our children's mental health?
Senator, on a personal level, I have a grandson who's the same age as your children, so I completely understand.
Thank you.
If I may turn this to Dr. Josh Gordon, who's the director of NIMH, to answer you specifically.
Absolutely. Thank you.
Yeah, to add to that personal, I have children who are 20 and 25 who grew up with social media and saw them wrestle with it and the challenges they're in. And I can absolutely, from that personal perspective, understand the situation.
And I think if you look at the correlation, so from 2011 to 2019, the CDC says that depression amongst our children, our high school kids, more than doubled. It is no coincidence that that actually coincides with the exact time where we had a rise in social media.
For that matter, not just depression, but suicide deaths have been dramatically increasing in children, and children who are even younger than used to typically die. So we're seeing dramatic increase in the rates in preteens, which is incredibly disturbing. So what are we doing about social media and mental health? We and the National Institute of Child Health and Human Development both have programs in understanding the impacts of social media, and importantly, looking specifically at what aspects of social media use correspond with negative outcomes from a mental health perspective, and trying to figure out how we might intervene, and especially trying to support families in parents and working with children to figure out how to avoid the negative consequences of social media and how to regulate social media use at the family level. So we have a range of different programs in this research and that we've been supporting with specific dollars that have been appropriated by this subcommittee in the past, and we will continue to support that work.
I hope that you will all continue to work on this, to pay close attention. Our children are counting on us. I want to follow up on what Senator Schatz said earlier. We have introduced a piece of legislation along with Senator Cotton and Senator Murphy to help with this. It's bipartisan. It prohibits children from under the age of 13 from using social media, which is consistent with what social media companies say that they already do. It requires a parent or guardian's permission for children ages 13 to 17 to create an account, so very simple. And the last thing is it requires social media companies to verify that quickly, but it also does not allow them to utilize algorithms against our children. So between 13 and 17, when they're on social media, they would not be able to be targeted by algorithms, pushing them into what we know to be so many deep, dark holes. And so I am hopeful that this body will act. I am hopeful that we will come together and actually do something to put parents back in the driver's seat and to protect our children. I will tell you, they are counting on us. Thank you. I yield my time.